Awesome. Well, thank you so much for attending our ongoing health professions series. Last semester, we began with the Hispanic Dental Association, followed by a conversation on taking a gap year with the Latinx Medical Student Association. And if any of our scholars were unable to attend our previous panels, I'll be sharing a link to that if you're interested. So before we begin, I also want to thank our panelists for taking some time out of their schedules to share their experiences and answer any of our questions. This event is hosted by the Carolina Latinx Center and our Pulso Scholars Program, which is a pipeline program for underrepresented undergrad students interested in the healthcare field. This is a 3-year cohort program specifically designed to cater to guide our scholars in reaching their academic goals. And yeah, today we want to present you all with Health Through Our Lens. There are various pathways into the healthcare field. For some, it may mean clinical practice, and for others, it may mean research or program implementation, and whichever path you decide to take is the right path for you. And our panelists are students or practitioners from the UNC School of Medicine, School of Dentistry, and School of Public Health. So I will pass over our Zoom mic to our first panelist, and I'm just going to go by like whoever I see. So Ileana, could you just share, and I guess everyone as well, just share a bit about your path to graduate school or your program or your current profession and why you are interested, or what made you pursue that. So
yeah, okay, yeah. So this is the 5 to 7 minutes, right? That's right. Okay, great. So hi, y'all. My name is Eliana. So I'm currently an MS PhD student in the Health Behavior Department in the Gillings School of Global Public Health. So I kind of arrived at public health early on in my undergrad career. I thought that I was going to do medicine or engineering just because I loved sciences. However, I went on an engineering service trip to Honduras and ended up falling more in love with the public health side of it and feeling like we need better ways to do interventions abroad than just sending 18 to 21-year-olds who are not experts in even engineering, at that time, to work in communities. So from there, a passion of equity, of ethical public health work, and that kind of field emerged while I still was holding on to this love for biological sciences. So I did major in neuroscience just to really understand the neurological underpinnings of behavior. I can't say that that's what I got from my degree in neuroscience, but I do think that it helped me develop a lot of the skills, the research skills that I use as a public health scientist now, particularly around research design, learning about causation, and just different ways that variables can relate to each other, which I actually didn't get from my global health coursework to the extent that I got from my neuroscience coursework. So it's just kind of like what I got from it is just how to learn and how to read research. So I think I was wrestling between psychology and neuroscience and public health throughout my entire undergrad career. And then it came to the end of it and was like, well, what do I do now? And I kind of was oriented towards the psychology side with a public health lens and just trying to figure out how to do that. And so I took a gap year, and in that gap year, I worked as a lab manager in a neuroscience lab that focused on decision making for exercise. So it kind of combined all my passions of like health behavior and looking at health and as well as the biological underpinnings of that, which was great, but ended up realizing that I cared a lot more about the structural determinants of how those health behaviors are distributed and how burden of health is distributed. So I started asking myself more questions like, okay, great that like when we provide socially framed motivational messages, people are more motivated to exercise. However, if there's no sidewalks near their house, how are they going to go on a run? If they are living in a dangerous neighborhood, quote unquote, how are they going to feel safe walking around and getting their steps in? So as I kind of asked myself how psychology intersects with more structural determinants, I was leaning a lot heavier towards public health. And I think that's where I ended up choosing to go there. Um, and it was just a great fit, particularly because I think as my passions for activism and racial equity increased as the greater amount of time that I spent in the South of the United States, I definitely wanted to be more oriented towards structural determinants. And I think that the program that I'm in right now, which is in health behavior, does a great job of preparing us. And also just like the community we've created in health behavior is great to really build our knowledge in social justice as it relates to academia. And I'm able to, I feel like I'm able to hit all my passions in a sense.
Wonderful. Thank you so much. Santiago?
So so for me, global health, I hadn't heard of global health before college. And so I was like signed up my freshman year for like a intermediate Spanish class. And then I got in there and like, I'm a native speaker and they were like, yeah, you shouldn't be in here. So I had to switch out of that class. And then in the scramble to like of the ad drop period to like try to find a class that fit that time slot, global health, like intro to global health was a class that still had an opening. And I was like, that sounds kind of interesting. And then pretty much like since then I was like, oh my God, like this is so cool. This is like all my interests. So I'm in medical school now here at UNC. I was like, this is like a lot of my interests with science and health, and still like a lot of my interests with like culture and people and behaviors and interactions between people. And I just really like pursued that like hardcore throughout college, majoring in global health and then majoring in culture anthropology. I think a lot of the time was doing a lot of like introspective research on, like I did some work, like I'm a first generation immigrant like to this country. And so doing research with like Latina house cleaners in Durham, that I saw like similar stories to like my mother and my aunt. And then going on to do like more research about how migration affects like family dynamics. But still the whole time, like I knew like medicine was still kind of like what I wanted to do or the path that I was going down. So still knocking out like those prereqs that you have to do for med school. And then I graduated and my GPA was like not good enough to get into med school. And so I had to fix that. And so I did, I got a job doing some like global health research while at the same time like fixing one of my biochem grades that I had to retake. And then like through that got some global health research experience, and then got trained as EMT like while I was doing that global health research. There's a program out in Lenoir, which is like super rural, but they do the training pretty much like completely online. And then you just go for a couple weekends to learn all the hands-on skills. So that lined up nicely with like still maintaining like a full-time job. And then like I got into the EMT class. I was like, this like affirms like everything that I want to do with medicine and go into like hands-on medical care. And so fixed that biochem grade, still had a couple grades to fix. And so I took a postback at Meredith, did like their 1 year postback that allowed me to kind of boost my GPA a little bit and be a little more competitive for med school. Worked as an EMT like throughout that time. So got more like clinical experience in, and then got a job as a phlebotomist for Durham County Public Health. So right downtown, where, you know, everybody that, you know, needs any kind of blood work, with or without insurance goes. And so got more clinical work through that, like learned how to draw blood, worked as part of like the Durham County Public Health like system, as part of that team. And then left that job while I was applying to med school to work in the emergency room over at Duke. So working like night shifts over there. And just like kept pursuing like this clinical experience, because I think for me, one of the things was that I always knew that like research, especially like bench research, like I didn't like at all. Like I think when I first took like an orgo class or like a biology class, I hated like pipetting stuff. I hated like waiting a bunch of time for experiments to finish. And so I was like, this is not like the route for me. Like if this is what research looks like, then I know that like research is not going to play a part in my path to medical school. So it wasn't until after graduation that I found out about global health research, and just like the whole clinical side of research, and that research can take a lot of different shapes. And so that kind of changed how I saw research and how I felt about it. But in the emergency room, honestly, that's like my favorite job to date. I think it's just like being a part of a healthcare team, working with nurses, nursing assistants, doctors, attendings, medical assistants, the insurance people, like pretty much like everybody that is a part of the hospital healthcare team. And being one of the like the lowest positions on the team, I think gives you like a perspective that I think is necessary, like going into medical school or going into any kind of health profession, so that you know what being a part of that healthcare team looks like. And so my path has been, you know, I took 3 gap years in doing all this. And so it's not a straightforward path, but I think what I've realized the most is like, if it's something you really want to do, like whether it's med school, PA school, like dental school, whatever, like it's going to be up to you, like whether you want to like give up or not, like on it. I don't think like, you know, I graduated with like a 2.9 like science GPA, and like that would have never got me into med school, you know? And so I could have just kind of stopped it there and been like, well, I should start considering, you know, paramedic route, or I should start considering like other health profession routes. But there's always a way. There's absolutely always a way to get to where you're going. There's people in my class that, you know, did a whole career outside of medicine, you know, got their PhD in English or whatever, and then had a complete career change to medicine. So I think that's the main message today moving forward.
Awesome. Thank you so much for sharing. Jesus?
Hi, everyone. Let's see. My name is Jesus, and I'm a PhD student in the Biostats department at UNC Gillings. So I guess I'm a little bit different in the way that I'm kind of like connecting my math side with like my love for like public health, but it wasn't like really a straightforward kind of like path, just like Santiago was kind of like mentioning. And I initially started like with business. So I was all about the money, making money. But for some reason, that wasn't just kind of like fulfilling. And I felt like I kind of wanted to like do something that wanted to like help out my community. And when I was studying in undergrad, I went to the University of New Mexico. While I also lived there, I did 2 pipeline programs, just like El Pulso. The first one was El Puente, which was mainly focused into getting like underrepresented students into like getting to do research and frame research questions and get paired up with like a mentor. And the other one was McNair. I think UNC has a McNair program. So I did both of those, and while in McNair, I attended like a couple research conferences, and I got to like go see this research poster that talked about like how the amount of like children that die in Nepal like every single year in regards to like waterborne diseases. And it just kind of like reminded me of like my childhood and just like so I grew up in Mexico, and I remember like growing up, like I would just see like my friends was like these very like dark brown stains on their teeth, and it was because of the high sulfur levels in the drinking water that was in the community that I was living. And I just remember like some kids that had like access to like the filter or whatnot, that they were kind of like a little bit like better off. Like they would be making fun of like my friends because they didn't brush their teeth because they had like brown stains on their teeth. Um, so I guess like while attending kind of like these research conferences and getting to know more about like what it is, what research is, what public health is, I got to know that I really wanted to like do something that kind of like involved my community. And I was searching throughout kind of like that room, and there was just like no research projects in regards to like the Hispanic community or like my people. So I guess that was kind of like a waking moment of like me kind of like realizing that I thought I had found like my motivation for like undergrad. And so one of my research topics for El Puente, which was about like framing questions or whatnot, was about making a research proposal to look into like the high sulfur levels in my community. But unfortunately, it didn't get like funded. But I was able to like go to Nepal and like work on the waterborne diseases kind of like project. And so for my senior thesis during undergrad, I went to Nepal and we did a study. And I guess throughout like working with the community and doing surveys, analyzing data and using kind of like statistics in the way that kind of like help public health, it really made me realize I wanted to like do a career in biostatistics and be able to like implement my skills in data science and math into ways that do not only are like books that people try to like stay away, but actually have like a real impact in your community by showing what is it that is affecting these people to have like waterborne diseases, what are like the risk factors, who's at more danger, what kind of like intervention policies can we like advise for these politicians to take so that the number of deaths in regards to like waterborne diseases kind of like goes down. And so at that moment, I saw that I really wanted to do a master's or a PhD in biostatistics, and which made me want to like apply, and that led me up to where am I right now. And I guess like throughout kind of like looking into in what ways can I like help out my community and kind of like making me go out there and look for like answers, it led me into like this research program. Um, so yeah, that's my trajectory to my PhD program in biostats currently.
Thank you. I have like so many questions already for all our three panelists so far, but we'll wait until we hear from everyone. Adlet?
Hi everyone, my name is Arlette. I was born and raised in Cuba, and I moved to the US when I was 14 years old. So I had to do, I got to do high school here. When I was like in high school, I was like completely lost. I didn't really know what I wanted to do. And like always, it's our teachers that kind of influence our decisions and what we want to pursue in life. One of the most influential ones were my art teachers. I've always been very passionate about art. So I got the opportunity of taking an AP art history class when I was in my last year of high school, and that sort of gave me an idea of maybe this is something that I wanted to do. However, like I knew that that wasn't something that would fulfill me. And this is like a theme that I feel it's been brought up before by the other panelists, is the idea of finding purpose in life through your career. So I decided that I wanted to explore outside of our history and see what else was out there for me. My uncle is one of the only people in my family that actually went to college and graduated. He's a doctor. So I was like, oh, maybe a career in healthcare might be something I would want to do. And dentistry sort of became the perfect fit for me because it had all the aspects that interest me: science, art, and also patient care. So when I started college, I decided to change my major to biology, because everybody was telling me that, no, you cannot do art history and go into dentistry. But that is not true. So I decided to change back. So I completed my major in art history while doing my prereqs for dentistry, which are basically the same as any other, like for PA or medicine. And while completing my major, I was able to just expand my knowledge about things that were outside of science. And I think that's one of the things that I appreciate most about the decision that I took to keep that as my major, because art history is such an interdisciplinary field. I was able to not only appreciate art, but was able to learn about aesthetics, proportionality, color theory, about cultures. And that is something that has sort of integrated during my time here in dental school. Right now we're taking a class, I'm a second year dental student, so we're taking a class on orthodontics, which deals a lot with facial proportions. So those things kind of helped me find an interest in dentistry, which goes beyond just health, but also aesthetics. And I guess that what I really like about dentistry now more than before, I think that every day that I spent in dental school kind of solidifies the fact that I really wanted to have purpose in life. It's because of the fact that dentists play an extremely important role in healthcare overall, because there are so many more people that go to their dentist than their primary healthcare provider. And we are a facilitator of catching certain systemic diseases that maybe people are not aware of. And also the fact that there are so many underrepresented minorities that are affected by the fact that they don't have access to healthcare, and they don't have access to oral healthcare. So I think that this path has allowed me to realize how much more I can do for my community other than just the day-to-day seeing patients for a filling or anything, things like that. And also another aspect that really drew me to dentistry was the fact that you can build your own practice. You can be your own boss. And it goes beyond just setting your own hours and making more money, as people say. It's really more about building the kind of practice that you want, that adhere to your values, that adhere to your vision, and it will allow me to practice the kind of dentistry that I want to dedicate more time to community outreach, to charity work and things like that. So that is my spiel.
Awesome. Thank you so much. Virginia?
Hello, everybody. Thanks for having us on here representing the dental school. Can y'all hear me okay? Okay, awesome. So I am a third-year dental student. My trajectory to dental school, I think is like a bit different from the majority of my classmates. So I completed undergrad here at UNC in 2014. When I initially started college, I went in with the idea that like maybe I would like dentistry. When I was a freshman, my cousin, who was a senior at the time, was like in the process of applying to dental school, and this kind of might sound a little cheesy, but I saw like an Operation Smile commercial on TV over the summer, like the summer before college, and I was like, wow, like that's great. Like people, you make such a difference in people's lives. Like I want to do that. So started college thinking that dentistry is what I wanted to do. And after my first semester and after that like Chem 101 and getting those grades back, I was like, oof, maybe not. Like maybe I can't do this. Like maybe science is too hard for me. And so like I essentially like I gave up. I was like, it was too much. Like that transition from like high school to college was very difficult for me. Being a first generation college student, not really having like my parents or like older siblings to lean on, just because I was the first one to attend a four-year university, not really knowing like how to get through that, and then kind of trying to like get by on my own. I had to figure something out. So I decided to switch my major to political science and global studies, thinking like, oh, I'll go to law school. And so, yeah, I did that. And like, I definitely don't regret having that major, because it was something that I really enjoyed. And with my political science major, you don't technically have a focus, but I decided to kind of like build my own major with a focus around Latin American politics. So I feel like that kind of helps me a lot of times when we do have Spanish speaking patients. It helps me kind of relate to like where they're coming from and understanding, if they are recent immigrants, kind of understanding the political atmosphere that they left. So after I graduated from UNC, I worked a corporate job in Raleigh for a few years, and thinking like, well, maybe I don't want to go to law school, but maybe I'll like go back and get my MBA. And just like thinking like, oh, dentistry is it's not within reach anymore, because I didn't do any of the prereqs. And, I felt like it was too late. Well, needless to say, I hated an office job. Wasn't for me. So I remember like through the CLC, there was some program, I forget what it's called, but they would have like professionals come in and speak to us. And I remember meeting a dentist who works in Winston-Salem. And I spoke to her like, oh, like I wanted to be a dentist at one point, but like decided that I'm going to go to law school. And I remember her saying like, Virginia, it's never too late. Like the time is going to pass, whether, you want it to or not. And you're either going to spend it doing something that you want to do, or doing something that you don't want to do. And she was from Columbia and actually did dental school in Columbia, moved here, and her like dental degree from Columbia like wasn't valid here. So she did dental school again at UNC actually. So she was like, I graduated after I was 30, and like, but like I had a goal, and like I wanted to be a dentist. I am a dentist, and I wanted to be able to practice here in the US. And so she kind of like stayed in the back of my mind for those few years when I was trying to decide what I really wanted to do with my life. And so I was like, you know what, I'm going to do it. I'm going to go for it. And I went to UNC Greensboro to do a postback. So I could apply to dental school. And I actually got back in touch with that dentist. Her name is Dr. Hanau. And she's like my mentor now. And, always says that there's a job waiting for me when I'm done. So like just having that connection was super important. And so in terms of like why I chose dentistry, just, wanting to, like, for me, like my parents, they're immigrants from Mexico, and it might be the case for a lot of people, but I'm their retirement plan essentially. And so I know that once I'm out there, I'll become the breadwinner of the family. So I knew that I wanted to have a career that not only that I enjoyed, but that like everybody else has been saying, that is fulfilling, but also a career that would allow me to have a financially stable life, and at the same time provide my parents with a much needed like retirement. So that's a big reason why I chose dentistry, because I wanted something that I could be hands-on. I'm a very hands-on person, and just, doing something different every day was going to be super important for me to just not be bored doing something for 30 years of my life. So that's a big reason why I chose it. And then, like Arlette was saying, just as the time goes by in dental school and the things that we get to do, like helping, especially the Hispanic community, we run a free dental clinic in Siler City. And just every time, we go there, it just feels so good to be able to help people and to be able to help them feel better, be able to help them look better. And they're just so appreciative that like, I know that this is the right place to be. So after my postback at UNCG, I worked again for a little while I was applying. And yeah, now I'm here. So that's it, I think.
Great. Thank you all so much for sharing your stories. And Although I do have some questions, I want to be able to open up the floor to our scholars if they have any questions first. So you can either type it in the chat or feel free to just go ahead and ask.
So a lot of y'all are like in graduate school. So how is like, I guess, funding that? Like, how is that going? Because I think one of the scary things for me is like just like a bunch of loans. Like that's what I don't really want. So yeah.
So I don't know if you, oh, Jesus, you can go.
Oh no, you can go if you.
Well, we're both in PhD programs, so I think it'll be similar. So PhD programs generally, they should be funded in the sense that your tuition is covered and your you get a stipend. And sometimes that comes with just like your admissions package, but at least like in my department, it doesn't. It's year to year. You need to find funding, but that's not a hard thing to do. Like right now I'm TAing and that covers everything. Last semester, it was through a research assistantship, which I would be doing research anyways. So that just covers my tuition. Also, in public health, most often than not, you need a master's degree to get it. And I knew that I was absolutely in no circumstance going to go into debt over a master's degree, which is why I was thanking my lucky stars that I found this program at UNC, which has like an MSPH to PhD track, which just means I can get my master's on the way and but still be considered a PhD student the whole time so that they cover my tuition. That being said, there are ways to get your master's paid for. Don't believe what everybody told me. There's zero way to get that paid for, but I have friends who got it paid for. So if you need resources, reach out and yeah.
And just adding to what Eliana said, make sure you apply to like more than one program, and then once you have kind of like those offers, you can like say, oh, person A is offering me like this much, can you like match it, or can you like increase it? And I felt like that's what I kind of like did. And I did get like some offer from like other programs, and I got UNC to like even increase their offer. So don't only take it as a way to like just cover it, but you can also get a little bit more of money by just applying to like a few graduate programs, and then just asking people to match other people's offers.
I'll kind of go into a little bit about like funding dental school, and Arlette can jump in if she has anything to add. It is very pricey, and I mean I have a lot in loans, like, but like something that I always think about when I go and like log into my like loan servicer account just to like scare myself on the amount that I have, and to humble me a little bit, is just like it's an investment in your future. And while you do want to like obviously like live on a budget, I usually take out the max amount of loans every year and then give back what I don't use, just to have that money there in case there's an emergency. And at least for us, like we can give the money back before like the end of the semester, and like that interest on that amount you give back like goes away essentially. So yeah, like I mean I got a scholarship from the dental school. It's not much, but it's something. And what Jesus was saying, like definitely like kind of leverage your options and apply to a lot of programs. Like hopefully, somebody will offer you money, and then you can go back to maybe a program that you're interested in and negotiate with them essentially. And even if you don't get offered any money, like if you're between a couple of options, like don't be afraid to like call them and be like, hey, so this is what I like about your school. This is what I like about this other program. Like, why should I go to your program? And like the fact that you were admitted to me says that, you're wanted, and they're going to, do what they can to get you to go to that program. So, leverage your options, and loans are scary, but I think it can be managed, live on a budget, and then just think of it as an investment.
Yeah, I would say the same thing. Some people work during their medical school career and dental school, but that's pretty hard to do. So budgeting is going to be your best friend. Going to the cheapest school you can is going to be your best bet for sure. And yeah, I mean, you're going to be able to pay it back. You are going to build a very solid career wherever it is that you end up. So if whatever it is you choose is your calling, I think it's worth it. It's worth it.
Yeah, I think similarly, med school is very expensive. I think it starts like at the stage that y'all are at, like when you're undergrads, to start kind of making those moves to save money. And so like even like when I was looking at postbacks, you know, Meredith is a postback that you could use like FAFSA money for, or you could apply to FAFSA aid. And like not too many like postbacks like that. Like I know Duke's is like private, so it's like a lot of money to do a postback. What else? I think in like test prep and a lot, like you can, if you do some research and like you can cut some like money out by like doing test prep with like free or reduced price like materials that already exist. I think applying to med schools too, specifically, this is all specific to med school, or maybe, but I only applied to med schools that I could like drive to and like travel to like really cheaply. So I wasn't applying to like schools out in California or like in, you know, Arizona and things like that, just because I knew that those transportation costs would be really expensive. And I think it's exactly what Virginia was talking about, of like just like knowing your worth, and knowing that like because you are like underrepresented in these health professions, and because you're all like the amazing people that you are, you're likely going to be able to have these conversations, as intimidating as they are in the moment. And so I know like once I was at the interview stage, and then once I was at the like accepted stage, it really was like telling the school like, hey, like love your program, but like finances is at the forefront of my mind. And it's something that's really important to me. And, you know, it helped to be able to say like, this school is offering me like this much to go there. And so that's pretty much exactly what I did with UNC. I was like, you know, you guys are at the top of my list. There's a private school offering me this much money. But I would rather go to a school that like is invested in their community, you know, like told them pretty much why I value their school over the others. And so was able to like work out something where I got, you know, like full tuition scholarship from UNC. So I'm not like, all the money that I'm taking out is just for like housing and everything outside of med school. And so through that, like saving a good bit of money. But I think like others also talked about, is knowing that the career that you're taking up on the other side of school will allow you to live financially stable. I think one of the annoying things, like while you're applying and before you get to whatever graduate school you're applying for, is the people that tell you like not to make finances a priority are usually the ones that already have like the finances. And so like maybe not a key thing to like highlight in your interview of like, you know, like the money's really important to me, but like it's okay like if having a financially stable future is important to you. Like that's not a bad thing. I think especially for, you know, students like us that are coming from first generation families and underrepresented communities, like it's okay to want that for yourself. And I feel like a lot of times it's made like it shouldn't be.
Thank you so much. Really great responses. Are there any other questions from our students? Okay, well, I have a question, and maybe this can lead to another one. So a couple of you talked about postback. Could you clarify a bit more what is a postback and why should you do that?
So in my case, so postbaccalaureate, my understanding, and so I did it, and so it kind of sounds bad that I don't exactly know what it is, but my understanding is that essentially like classes you take after your bachelor's degree. There you can get like, I think, some sort of certificate for some. It depends on the school that you go to. The one that I did at UNCG did not have any sort of like certificate associated with it, but they did have like a well outlined program, like if you're interested in like pharmacy school or medical school or dental school, and I think a few other health professions as well. But you don't receive any sort of like degree or certificate at the end of it. I do believe that there are some that do. I might be mistaken, but that's my understanding of like what a postback is, and that's what I did.
And so I think when I was looking at postbacks, there's generally like two branches of postbacks. And so one is like academic booster, and so that's to like help boost up your GPA from whatever it was in undergrad. And then the other one is like a career changer, and so that's for people that kind of need to like start from scratch and take all of the prerequisites for whatever graduate school they're aiming for or shooting for. And so the one I did at Meredith, they offered kind of like both tracks, but it was mostly like academic. It was like designed to retake courses or take additional STEM courses that you didn't get a chance to in undergrad, to boost that science GPA that's looked at differently. I know for sure for med school. It might also be for like other schools. What else about postbacks? I don't know. I mean, like they're gonna cost you a little bit more money. So I do have loans out like from my postback, but it also allowed me to get more like volunteering and like shadowing and clinical experience like through it. So yeah, I think they're great. I think when it comes to the ones that are like, I know the one at Duke is like a master's of biomedical sciences, and like not to like trash talk them or whatever, but like I personally, I don't see the point of getting a master's that you're never going to use, because it's like the stepping stool to the next school that you're about to get into. And so like the people that I know that did it, they have their master's of biomedical science, but then they immediately like applied to med school. And so it's not like they're applying that master's towards any kind of job or towards any kind of work. I think the additional benefit of doing the one that counts towards your bachelor grades is that it's, so if you do a master's, it's counted as a separate GPA. And so for some people that helps, but some people that's not going to do anything for your undergraduate GPA, which is what I needed to boost academically.
Okay, thank you. Yeah, I think my follow-up question would have been why do a postbac versus a master's, but I think that answers it. Very much.
I have something quick to share, but I guess from like the area, like my area, like the postbacks, I was considering to do 2 postbacks, and I guess I was deciding between doing the PhD that I'm like doing and this postback by, I don't know if you guys remember, but whenever there was like trends of the COVID-19 kind of like estimates, the University of Washington were doing kind of like those kind of like estimates. Well, I was considering doing a postback with that institute that is funded by the Gates and Melinda, Bill Gates and Melinda Gates Foundation. And so if you're able to look for like postbacks that are kind of like have ties to like industry, you can actually get paid for. Like on that one, I would be getting like paid like $60K a year, be able to take classes for my master's. But the one drawback that you have for that is that if you're very well situated right now, as in your undergrad, and you have like a really nice GPA and you have like the letters of rec, that will put you in a very good kind of like PhD program. Then you might not want to like risk it by doing like a postback, kind of like going to a very hard school and then maybe getting a C in one of your classes, and then that making it harder for you to get into a really good kind of like PhD program. And the other one was at Johns Hopkins. And I know that Johns Hopkins has kind of like a few postback programs that are not only in biostatistics, but like other areas in public health. and they're basically like research oriented kind of like postbacks, and then you do kind of like some research, and then by doing that you can establish your presence in kind of like the department, and then build a connection for you to be able to like apply for like programs. So you can also you should definitely look into like postbacks that maybe have like ties to like industry, because those would be kind of like paying you money, and it would be kind of like, I don't know, fun too. But just my thoughts.
Thank you. Another question I have is, so several of you, let me see. Several of you talked about taking gap years, and what would you suggest? Like, if you have any classmates that have gone directly from undergrad to med school, versus your own personal experiences on taking gap years, could you all speak a little bit more about that? Like, why take a gap year?
I think it's just case to case. Like, depends. I think like if I was crushing it in undergrad, and like I might have not have needed to take 3 gap years to like fix my grades and get a bunch more like clinical and research experience. Yeah, I really do think just it matters like why, like very, very widely, like on a case to case. Like one of the pros is that of going straight through is you're kind of still in that student mindset. And so like I got pretty used to like a cush 9 to 5 and not doing homework. And so that was kind of like a transition coming back to school. But at the same time, I just feel like I grew a lot as a person, like in those gap years, like working a job with people like in different, like from different backgrounds and that kind of thing. So like I would never have done it differently, like based on my own situation.
Yeah, I agree with that. I think it just depends kind of like, yeah, if you're in a position that you like a good position to be competitive and apply to a program after undergrad, then, you know, by all means do that. But like if you're unsure or, you know, you're just not ready yet, then I think gap years are pretty valuable. I mean, me personally, like I went through the whole like career change and all of that, but like working for well, collectively I think like 2.5 years, really gave me a lot of skills that I wouldn't have had, or I didn't like learn in undergrad, like time management, working on a team, and also just kind of like getting to like know myself, and like what my interests are outside of being a student. So I think for me, that's personally been super helpful, like kind of transitioning back to being a student, because it's like I know what my interests are and I know what my hobbies are outside of like school. And so that kind of like helps me manage my stress, because it's like I don't want to think about teeth anymore. I want to go do something else. Like, what do I like to do? So and I see that like with my friends that went straight out, they're kind of just like school. And you know, like once, like for us, like after our third year, like third year summer going into fourth year, like we really have just so much more free time than we had like previously. And I've known fourth years to be like, I don't know what to do with myself. Like, I don't know what my hobbies are. Like, maybe I'll try baking or something. So I guess like that's the advantage that I saw in it. Like, it kind of like, yeah, you grow up a little and you learn a little bit more about yourself, so that you can kind of like separate, like you have like a better work-life balance, in my opinion.
Hi, sorry, my laptop died, so I'm joining in the square. I completely agree with you, Virginia. I think that the greatest thing that gap year gives you is experience. And I think not only it impacts your work-life balance and your personal life and enriches that, but I think it also makes you a better student and a better scholar, just because you learn so much in those years that then you're able to bring that into the classroom and really make the most of your education. I have seen, especially in a PhD program where it's all about, you know, being an expert in a niche, like in a particular area, I see such a big difference, even in master's students, between students who haven't taken any gap years and students who've taken 10. That being said, I've seen students who've taken 15 gap years and still don't know what they want to do with their life, which is fine. But I do see that those of us, I mean, I only took one. That's not a lot at all. And I often feel like I should have taken at least 3 more to just get more experience in public health and see what area I want to be an expert in. Because like now I want to already know what classes I should take to get to where I need to be. But right now I don't know that where I need to be is super, super clear in my mind. So yeah, I just think it makes you a better student. It makes you ask better questions in class. It makes you figure out which readings you want to focus on. Like, and you bring so much more to the classroom too. So I love gap years, take all of them.
I think, yeah, I think having, like, I went the clinical route, like pretty hardcore, because I knew that like research wasn't my strength and neither were grades. So I was like, all right, clinical it is. And that's helped so much to be in class and already know like how to take a blood pressure, how to splint, how to do like CPR, like how to do an EKG, how to like, just like so many tasks that like you do feel like miles ahead of the game with that real world experience.
Yeah, I just to hit the nail again, experience. It's a big thing. After I graduated, I actually applied while I was about to graduate. So I had a little bit of time between just graduating and starting, and I got a job at an oral surgery office. And man, that is like the most amazing experience I have ever had, because I was basically seeing patients every day from 7 to 5, 6, 7 p.m., doing notes, learning the dental jargon. Just makes me feel that much, it made me feel that much more confident starting dental school in terms of my clinical abilities. Not necessarily my hand skills on like fixing teeth, but definitely in managing patients, communication with patients, and just feeling comfortable. Also, if you can get a job in an office, wherever it is that you want to end up, it's really helpful to know what it is that you want your office to look like. Just picking up what the office environment is like, how the employee management is like, scheduling patients, learning about insurance, all of those things were just invaluable. Nothing that I could have gotten from being in school.
One more thing that I'll add, having like had experience out in like the real world before applying for dental school really helped me on interviews. Like, I'm typically a super introverted person, and like, I mean, you can go throughout like your entire undergraduate career and not really have to like engage with that many people, honestly, which is what I did. So having a job, like, you know, helped me work on like my phone voice, and really like helped me like just up my interview game. And honestly, like, I think that's probably like the interview, like that's where I like, you know, hit the home run. Like, let me get my foot in the door and like, let me talk to you. So just, you know, if you are a bit shy or you don't like work well with people or don't know how to work with people, like going out into the like real world before you do that, like I think is very helpful.
We have a question in the chat, I guess a follow-up to this discussion. How did you all go about finding the opportunities for experiences during a gap year?
So for me, it was pretty straightforward. I did a pretty bad job of networking on undergrad with faculty, so I would say do that. So then my very last semester, I did an independent study with a PI, a principal investigator, just a faculty member, and he ended up being like, hey, my lab manager's leaving. Do you want to be our lab manager? And I was like, sure. Applying the job sounds hard. So that's how I got mine. I would say if you're considering doing grad school, there's a lot of ways to do volunteer-based things that you may not make money on. I think for me, getting a job that paid me was really, really important. Just because now I feel like I can be making bare minimum at like in my, because my stipend is bare minimum, but I have that cushion and that emergency fund that I got during that year, and that's just so important to like my mental health and my feeling of stability.
For me, it was if you have like a pre-dental, pre-med group in school, those are great resources, especially for shadowing. I graduated from Florida International University, and their pre-dental society is very involved. So they basically have a system already in place with dentists that will be willing to have you come and shadow and get that experience like that. Another thing, if there's a pre-health advising office at your school, they're an amazing resource. I actually got my job from one of the advisors. I was like, hey, do you need a job? And I was like, what is it? And I ended up being an oral surgery assistant. So having connections with people will get you pretty far, honestly. And just Google dentists in my area, doctors in my area. Don't be afraid to show up. Call them, be like, hey, can I go and talk to you? Bring your resume. If you're eager, if you're enthusiastic, if you're interested, they'll see that, they'll sense that, and they'll give you the opportunity for sure.
Absolutely. Don't be afraid to call around. I did a lot of like digging and LinkedIn stalking to find that one dentist that I met my senior year at UNC, and I found her. And yes, like shake as many hands as you possibly can. You know, the saying that sometimes it's not what you know, it's who you know. It's so, so true. I mean, I think that year that I was applying to dental school, I was in the dental school, and I was just like, hey, hi, like my name is Virginia, like remember me. And I think that probably helped a lot. There was something else I was going to say. Oh yeah, and agree with that, like reach out to like pre-med, pre-dental programs, or you know, whatever program you might be interested in. Like reach out to people in that program, because they can tell you like what admissions committees are looking for.
Okay, we have another question in the chat. Did you all find it was hard to make time for your families in school? How did you all balance being available for your family and having school be your #1 priority?
I think it's like a learning process. Definitely my first year, I think I disappeared from the face of the earth, and like, you know, didn't see that many friends or family until it was like winter break or spring break or what have you. But like, as I went on, like I had to like set boundaries for myself, and, you know, and like still do like on the weekends, I give myself like one day, like one whole day that I do not look at schoolwork at all. Like don't look at my email, don't open up my laptop, nothing. And like do what I have to do, whether that's like binge Netflix or run errands. And I think that's super important. And like as I've gone on, like, you know, I'm like, I'll give myself like one evening a week. So it's just like looking at like yourself and like seeing what's important to you and like setting those boundaries for yourself. And like if there's something that you really want to do, or you know, you really want to see your friends or family, like you just have to plan ahead and be like, hey, I have a huge exam next week, I have to make sure I'm studied up before I go do this.
I kind of took the same exact approach as Virginia, where I need to set boundaries, and I definitely take out at least one day a week where I do nothing school related. I think like especially now I typically don't live with my family, or I'm near my family because my family lives in Georgia. So, but because of coronavirus, we moved in back with my family starting in March, and that's been hard. So I really appreciate your question, and it's a hard balance, but I think it's possible as long as you have clear communication with them about what you can and cannot do. And just be like, hey, like, unfortunately between hours of this and this, I won't be able to be there for you. But during this and this, like, I'm all yours. And being able to just like focus on one at a time, because family is important, and it'll be good for your overall well-being at the end of the day.
Thank you. Another question. Did you guys have any challenges when it comes to studying? How did you overcome those challenges?
I'll try to go first for this one because I have to step away. I have an exam to take. But what I would say about this is making sure that you find the way that works best for you to learn what is effective. Because I feel like when I started dental school, I was spending a lot of time writing out my notes and doing the same things that I was doing in undergrad, and that's just not effective. You have to be able to bend yourself in many ways to be able to fit all of your cramped schedule and study for exams and volunteer and do all the things that you really want to do while you're in school. So I would say really hone in what it is that really works for you and it's effective for you, whether that is doing cards, practicing your recall, or handwriting your notes, or rewatching things. And that's really going to help you in that transition when the workload is even more. Another thing that I would say is give yourself some grace. Be flexible with yourself. And make sure that you know when you're struggling. If you're struggling, reach out to your school. They have amazing resources for you. They'll give you a tutor. They'll help you out. So just start early if you feel like you're struggling. Don't let yourself fall off the cliff, because that's really bad. And that's it for me, guys. Thank you so much for having me. I wish I could stay a little bit longer, but I really have to get this done. Good luck to all of the scholars. I'm pretty sure that Ariana can give you my contact information. If you have any questions, please reach out. Thank you. Bye.
So we'll take maybe another question and we'll just end our discussion. Yeah, does anyone have a final burning question? I wanted to speak a little bit, I guess this could be the last question of, so we're talking about like always being busy, always having to do work, always stress, all of this, but how do you also include your passions or things that you enjoy outside of academia for your well-being?
Just do it. Don't think, just do it. Like, my friends make fun of me because they're like, Virginia, are you studying? And I'm like, no, I'm like out enjoying the weather. I studied for an hour, like, whew, that's enough for me, bye. But no, obviously studying is important. Like, I do that knowing that I've done enough, beforehand. But kind of like what I was saying earlier, if you have like passions outside of school, make sure that you make time for them, because those are part of self-care. And grad school is hard and grad school is demoralizing, and you will forget that you wanted to be there. Like, you will forget that very quickly. So it's important to step away from it and kind of pause and refresh and then come back into it. And I'm like, oh, okay, I do want to do this. But if you burn yourself out, it'll be really easy to get to that point where you just want to quit and you don't want to be there. So again, set yourself boundaries and make time for your passions outside of school. So important.
And just adding to what Virginia said, I think what makes a good student is not only assigning kind of time for yourself to do well academically, but it's also pursuing kind of your goals and aspirations outside of school. So if you want to be a good student, not only do like well academically, but also like go out for like a walk and kind of like do whatever makes you feel happy or like makes you feel like grounded, like you're still you, because there'll just be times that you're just like, oh my God, I just want to quit and like go hide and like never come back and just drop out. But if you are to like add it as a component to like your daily life and to like your weekly life, then I guess it just makes a little bit, it just it just makes it easier for you to not feel weird whenever you're kind of like taking 30 minutes away of like your time and just feel very bad about like not being studying. So and that's what I've been trying to do. I'm just like, okay, I'm just gonna log off at 10 and I'm just going to like eat dinner and watch like a funny show, and then I'll go walk my puppies like during the afternoon. So just do things that you like. It'll make you happier, just like Virginia was saying.
I think in a very career focused way too. Like I think throughout anything I've applied to, like I've never been asked like, oh, like tell us about that time how you studied a lot for this one exam, or tell us about the time that like you did really well in this like class. You know, it's like, tell us what you're passionate about, like tell us what you do like outside of class. And so I think that's another reason why it's so important to keep pursuing your passions, because like whenever you have to talk about what you've done, whether that's in school or out of school, the things that you talk about passionately are the things that are going to be remembered, not like how much time you spent trying to get a couple more percentage points on an exam.
So true. Well, thank you all so much for being with us this evening. We really appreciate it. And yeah, thank you to our panelists for taking some time out of their very busy schedules, and to our Pulso scholars as well. And enjoy the rest of your day, the rest of your week. And yeah, we'll see you all soon. All right. Bye-bye, everyone.